Bismillahirrahmanirrahim. Quote of the day: a dream does not become the reality through the magic. It takes sweat, determination, and hard work. Uh, Today, the topic of presentation is research ethics. I am Dr. Rabbia Iqbal, PGR, Community Medicine, and presenting under the supervision of Professor Dr. Saira Afzal, IPS Lahore. Learning objective: by the end of this session, learner will be able to define the research ethics and its importance in medical and the public health research, describe the historical event and the major ethical code and guidelines, explanation of the three Belmore principle, PMDC guideline, identify a vulnerable population and special protection required for the each group, differentiation between research misconduct and responsibility of the ethic review committee. First of all, the definition of the research ethic. The research ethic refers to the moral principle, guideline, standard that govern the conduct of research involving human participants, animals, data, and scientific knowledge. Research ethic aims to protect research participants from the harm and exploitation, ensure the scientific integrity and validity of the finding, promote public health trust in research enterprise, prevent misconduct, fraud, and exploitation, and benefit in which society through the responsible research conduct. Why ethics matter? It is the landmark of the unethical studies that shaped the modern research ethics. In 1930 to 1940, human experiments in which the prisoners subjected to cruel medical experiment without consent led to the development of the Nuremberg Code 1947. Next is 1932 to 1972 Tuskegee syphilis study, in which African American men with syphilis denied treatment even after the penicillin became available, led to stricter the protection for human subjects. 1956 to 1970 Willowbrook hepatitis study, in which children with intellectual disability deliberately exposed to the hepatitis virus to study disease progression. So the Nuremberg Code 1947 developed after the Nazi war crime trial, first international standard for ethical human research, which include voluntary participation in is absolute essential. The experiment must be for the good of society, scientifically valid. Prior animal experimentation should justify human research. Avoid all unnecessary physical and the mental suffering. No experiment should be conducted if death of or the disabled injury is expected. Risk must never exceed the humanitarian importance of the problem. Proper protection against even promote possibility of injury. Only scientifically qualified person should conduct experiment. Participants have the right to withdraw anytime. Researcher must be prepared to terminate the experiment if any harm is anticipated. Next is the Declaration of Helsinki, developed by the World Medical Association, adopted in 1965 and revised last 48th edition, which include medical research standard, provide ethical guidance, especially for the medical research involving the human subject and participant. Informed consent required. Written informed consent is mandatory. Consent must be plain language accessible to the subject. PMDC adoption. Pakistan PMDC has developed a code of ethics for research based on Helsinki principle, binding on all researchers. Ethical committee approval. Research protocol must be submitted to and approved by the independent ethics review committee before study begin. Vulnerable subject protection. A special protection required for the group unable to give their own consent, for example, minor incapacitated individual. Good clinical practice. Researcher conduct RCT must possess a good clinical practice certified for the ethical review approval. Next is the Belmont report in 1979 established three fundamental ethical principles for research involving human subject, which include autonomy, good beneficence, and justice. Autonomy is the individual should be treated as an autonomous agent. Person with diminished autonomy are entitled to protection, which is right to make informed decision, voluntary participation, privacy protection, right to withdraw anytime. Next is beneficence, maximize the possible benefit and minimize the possible harm. Researcher must protect participants from the harm. risk assessment carefully, minimize the physical and psychological harm, ensure benefit outweighs risk, promote participants' well-being. Third is the justice, fair distribution of the research benefit and the burden. No group should be bear undue risk while another benefit. Fair participation, selection, no exploitation of vulnerable group, equitable distribution of the benefit, no discriminatory parties, practice. Next is the Council for International Organization of Medical Science, focus on ethical research in low middle income countries, address vulnerable population and international research, which include ethical justification, address ethical justification and scientific validity of the research proposal, requirement of ethical review, consideration of vulnerability of individual, group, committee, and population. Women as a research subject, special consideration for including women as a research subject with appropriate protection. Equity in burden and benefit. Equity required distribution of research burden and benefit among participants. Clinical trial control. Choice of control is clinical trial. Ensure the ethical use of placebo when which standard therapy exists. Confidentiality. Maintaining the confidentiality and protection of the personal data of the research participant. A compensation for injury obligation regarding the compensation of the research-related injury to the participants, strengthen the capacity, and sponsor obligation. Next principle, first one is the autonomy. Each individual has right to make informed decision regarding their research participation. Voluntary participation, person must join freely without any pressure or under the influence of researcher. Informed consent, participant must receive complete, understandable information about before deciding to participate. Protection of privacy, individual inform and data must be kept confidential throughout the research process. Right to withdraw, participant can leave the study at any stage without any penalty, negative consequences to their care. Next principle is beneficence and non-maleficence. Beneficence research must maximize the benefit and minimize the harm of the participant. Assess all potential risks carefully, reduce physical and psychological harm, minimize the social and economical harm, ensure the benefit clearly outweigh risk, protect if participant with well-being throughout, report adverse event promptly. Non-maleficence do not harm. Researcher must carefully avoid causing harm to the participant. Which include physical harm, injury, drug reaction, emotional harm, anxiety, psychological trauma, social harm, stigma, discrimination, and financial harm, in which job loss and economic burden. Next is justice, fair distribution of the research burden, risk, and benefit across all population. Justice include fair selection. Participants must not be chosen merely because they are poor, easily accessible, or the institutional setting. Equitable benefit, group that bear the burden of the research should also benefit from research finding and outcome. Avoid exploitation. Researcher must not take the advantage of prisoner, patient, economically disadvantaged, or the vulnerable group. Include all groups historically exclude population, women and minorities should be appropriately included in the research study. Next is the informed consent, a process through which the participant voluntarily agree to participate after understanding all relevant information. The informed consent include information. Participant must be told purpose, procedure, duration, risk, benefit, alternative, contact information written in plain language. Second is the comprehension. Participant must be genuinely understand the provide information, special consideration for language barrier and literacy level. Third is the voluntariness. Participant must be free for coercion, under undue influence, manipulation, or the threat. No penalty for refusal. Element for the informed consent, PMDC section, in which include a statement that study involved research, involved search, explain the purpose of the research study, explain the expected frequency of procedure, duration, and follow-up, identify experimental procedure used in the study, expected foreseeable risk involved in the subject, expected foreseeable benefit involved to the subject, explain any experimental procedure used. Statement describes the extent of confidentiality to be maintained for more than minimal risk. Explain who to contact for regarding the research or injury. statement for that participation is voluntary, statement regarding any financial benefit for the research from the study, consent from the written in uncomplicated language as per subject comprehension. Next is the vulnerable population, the group that require the extra ethical protection due to diminished autonomy, sustainability to exploitation, which include children, parent and guardian consent required, pregnant women, additional risk assessment needed, prisoner, special protection against the prostitution, voluntariness must be ensured, elderly person, assessment of decision making capacity required before enrollment, mentally disabled, additional safeguard and substitute decision making may be needed. Economically disadvantages protection against the undue inducement and exploitation. Risk benefit assessment before approval, and researcher must carefully evaluate all the potential risks against the expected benefit. Risk include physical, psychological, social, and economic. Physical include injury, adverse drug reaction, pain. Psychological involve anxiety, stress, emotional. Social risk include stigma, discrimination, privacy breach. Economic include loss of employment, social burden. Benefit, direct benefit, which include improved health, access to the new treatment, indirect benefit, contribution to the scientific knowledge, social benefit, better public health policies and practice, future impact prevention strategy for future generation. Next is the Ethic Review Committee, institutional review board, independent body protect the research participants. So the purpose of IRB is to protect the rights, safety, and well-being of the research participant through the independent ethic oversight. So the responsibility of the Ethical Review Committee are review, study protocol and methodology, assess risk and benefit of the proposed research, review and improve consent from the and procedure, monitor ongoing studies for the participant, safety, ensure compliance with all ethics standard, improve amendment of our protocol deviation. The document that are required include research proposal, study protocol, informed consent form, questionnaire and a data collection tool, recruitment material and advertisement, investigator CV and funding detail and conflict of interest disclosure. Next is the PMDC Code of Ethics for Research. All research projects involve human subject must be reviewed and approved by the Ethical Review Committee before the study begins. Written consent must be obtained if the patient are involved in the clinical trial. Consent must be plain language accessible to the subject. For subject too young, incapacitated, mentally ill, or unconscious, research is best avoided unless the beneficence to the patient with no objection from parent. Medical research involved human should be conducted only by scientifically qualified person under the supervision of clinically competent person. Research result must preserve patient autonomy unless a permission has given by the patient to use their name. Payment to volunteer should not be large as to be inducement of the participation. Refusal of participant in the research must not influence the care of the patient in any way. Next is the research misconduct, which include fabrication, falsification, plagiarism, ghost authorism, gift authorism, and duplicate publication. Fabrication, in which making up data result or finding that they were never actually collected or observed. Falsification, in which manipulating researcher procedure, material, data, equipment, process, or alter the result. For example, changing data value in SPSS, double sample size, or obtain statistically significant result. Plagiarism, using another person's ideal process result word without giving appropriate credit. For example, HEC Pakistan check plagiarism. So limit is 18% similarity exceeds this result in penalty. Ghost authorship, a significant contributor to the research is not mentioned in the author list of the publication. Gift authorship, a person is listed in an author despite not meeting the international committee medical journal authorship criteria for the contribution. Duplicate publication, publishing the same research in the multiple journal without proper disclosure. Next is the publication ethics. Avoid duplicate publication, salami publication, splitting a one study unnecessarily, ghost authorship, omitting real contributor, gift authorship, honorary listing without contribution, data manipulation, or selective reporting, fabrication, or falsification of any kind. In short, these practices, honest and accurate reporting of all findings, proper citation of all source and prior work, full transparency in the method and analysis, conflict of interest disclosure, timely correction of any error found post publication. Next is conflict of interest. A conflict of interest occurred when personal, financial, or other interests may inappropriately influence the research judgment and integrity. Common example include receiving funding from the pharmaceutical company while evaluating their drug, or owning the stock in a company those product is being studied, having a personal relationship with a participant or co-investigator, career pressure to produce positive result, consult fee or the speaker honorary for the from the industry sponsors. So, conflict of interest management include full disclosure, independent review, complete transparency, and rescual when necessary. Next is the special consent situation, PMDC guideline, standard clinical trial, written consent mandatory, aim and method is method of proposed research, potential hazard or discomfort must be explained in the plain, non-technical language. Children, parent or the guardian consent required. Child assessment should be sought where developmentally appropriate. Must both must agree. Incapacitated, mentally ill, and unconscious researcher best avoid. PMDC, a state researcher, is the best avoided unless it can be shown to directly relevant, potentially beneficial to the patient. Anonymity and the patient name result must be preserved. Anonymity research result must always be preserved patient anonymity unless the permission has given. Next is the importance of the research ethics include protect participant, shield vulnerable individual from the exploitation, physical harm, psychological distress, and social stigma. It ensure scientific validity. Ethical rigor is inseparable from the methodology. Rigor based, bias, fabricated, or enhance the credibility. Findings from the ethically conducted research are trusted by the scientific community, policymaking, and the public. Maintain public trust. Historical abuses eroded trust in the medical research. Ethical oversight is essential for maintaining the public confidence. Promote responsibility. Create a culture for accountability, transparency, and integrity in the scientific and the medical research community. Sixth one is to prevent misconduct, formal oversight mechanism, fraud, plagiarism, exploitation, and other form of research misconduct. So next we come to the MCQs. MCQs number one, a researcher want to enroll the poor patient because they are easily available, which ethical principle is most likely be violated. A, beneficence. B, confidentiality. C, justice. D, non-maleficence. E, fidelity.
C.
Yes, yes, C is the right option. MCQ number second, during the clinical trial, a participant decided to leave the study without a reason. According to the Belmont report, the researcher should A, continue follow-up forcefully, B, impose financial penalty, C, inform the employer of the participant, D, respect the participant decision to withdraw, E, exclude future healthcare services.
D.
Yes, D is the right option. MCQ number three, a researcher modify the several data value to achieve statistical significance. This misconduct is called A, fabrication, B, falsification, C, plagiarism, D, ghost authorship, E, duplicate study.
A.
B.
Yes, B is the right option. MCQ number four, in the vaccine trial, investigator carefully evaluate risk and introduce measure to minimize the adverse effect. Which ethical principle is being applied? A, justice. B, confidentiality. C, beneficence. D, autonomy. E, fidelity.
C.
Yes, C is the right option. MCQ number 5. From before the beginning of a study involving human subject, the investigator must first obtain A. Journal editor, B. Hospital director, C. Ethic review committee, D. Certification, E. Funding agency only.
C.
Yes, C is the right option. MCQ number 6. The researcher invent 50 survey response that never were collected. This is, represent A. Falsification, B. Fabrication, C. Duplication, publication, D. Plagiarism, E. Gift authorship.
B.
Yes, B is the right option. MCQ number 7. A study report reveal participant name without permission with ethical obligation has been violated. A. Justice. B. Beneficence. C. Confidentiality. D. Voluntariness. E. Scientific validity.
C.
Yes, C is the right option. MCQ number 8. A participant developed severe side effect during a study. According to the Nuremberg Court, the researcher should A. Continue the study regardless. B. Conceal the adverse event. C. Terminate the experiment if harm is anticipated. D. Remove consent form. E. Publish result immediately.
C.
Yes, C is the right option. MCQ number 9. Publishing the same research article in a multiple journal without disclosure is known as A. Ghost authorship. B. Gift authorship. C. Duplicate publication. D. Fabrication, and E. Falsification.
C.
Yes, C is the right option. MCQ number 10. A study involves the unconscious patient is planned according to PMDC guidance. Such research should generally be encouraged, be avoided unless directly beneficial and justified. C. Proceed without consent. D. Require no ethical review. E. Be conducted only by the student.
B.
Yes, B is the right option. So this is the answer key. This is the YouTube channel where the recording of this video will be uploaded. And thank you for your patient listening.
Thank you so much, Dr. Rabbia.
Thank you, Dr.